I recently returned from an event sponsored by Harvard Medical School with professors who practice at Massachusetts General Hospital, at Brigham and Women's Hospital, at Johns Hopkins. It was an amazing opportunity and I loved it. I wanted to tell you about it, what I learned, and the answers to questions that I was able to receive. Before I left, I surveyed thousands of you, and over 250 people responded with questions about prednisone, PMR, GCA, and other forms of vasculitis. And I am thrilled that I learned a lot and I have the opportunity to share these answers. So, a little bit more about the event while waiting for people to join is this was a continuing education seminar. Here's the schedule that I got to do. Multiple pages, and you can see Mass General Brigham, and it was amazing. So I flew all the way to Boston and got to stay at a beautiful hotel with all of these professors from Harvard. And we have our first question. Wonderful. How to differentiate between prednisolone withdrawal and infections? That is a great question. And I will bring it over. Okay. So Mohammed wants to know how to differentiate between prednisolone withdrawal and infections. This is really tricky because prednisone and prednisolone, I'm just going to refer to it as prednisone because they're essentially the same thing, is affecting the immune system. And so infections are a real problem. We're suppressing our ability to deal with infections. And so we're more likely to get infections. And some of the normal symptoms of an infection are muted or a little bit different while on prednisone. For example, if you normally get like red flushing, that might be less, or it's possible you might have less of a fever. There's not a lot of good research showing precisely about this, but you are definitely more likely to get infections when on prednisone. So, how do you differentiate between withdrawal and infections? So, I guess the next question is, why would withdrawal be confused with an infection? And that's really important to answer too. So, in prednisone withdrawal is a constellation of symptoms that are because the amount of prednisone you were on is now not enough for your body for whatever reason. Um, it's like you were taking an opioid or you're drinking too much alcohol and your body has gotten used to a higher amount. You're not addicted to prednisone, but your body is dependent on prednisone. You're used to being up here and now you're giving it this much. And so this gap is usually fine for most people, but for some people, it causes withdrawal, such as dramatic fatigue, achiness, like muscle pain, joint pain, sleeping changes, either sleeping a lot or not sleeping, weight changes, either like gaining rapid weight or losing rapid weight. And sometimes for some people, a fever. And so a lot of those symptoms sound a lot like what happens when you are sick with the flu or something. So it definitely makes sense that it's hard to tell the difference. And for most people, you can't tell the difference. You have to go talk to your doctor and let them know how you're feeling. You have to say, hey, I'm feeling this way. Is it because I just went down my dose on prednisone? I've been tapering. Is it withdrawal or is it infection? And then they can take a blood test. They can check your ears, your eyes, your throat, all the places, listen to your lungs to see if there's an infection somewhere. And they would be the ones who would have to rule it out. So that's a great question, Mohammed. Thanks for sharing. Okay, so the reason I am live today is because I got to go to Harvard Medical School and learn all about conditions that they never taught me about in pharmacy school. Um, these conditions I think they should have covered in my curriculum, but they didn't. And there are things like vasculitis, so that's like inflammation of blood vessels, and that could be blood vessels on the side of the head called giant cell arteritis. That could be like the big blood vessels around the heart. That's Takayasu's arteritis, and other forms of vasculitis. And then a related condition to giant cell arteritis is polymyalgia rheumatica. And this is a very common disease that I no one mentioned ever. I'd never heard of it in all my life until I became the prednisone pharmacist. But then I found out that it's the second most common rheumatic condition, which really blew my mind. That in Medicare, like people over the age of 65 who get health insurance covered by the government in the United States, it's the second most common rheumatic thing. So there's rheumatoid arthritis, which I definitely heard about, no doubt. But then polymyalgia rheumatica, second most common. And it's especially common in people who are over the age of 50, who have Caucasian ancestry. So their ancestors are from northwestern Europe. And to me, what I've seen is we're previously healthy, normal people, and suddenly get dramatic pain, like shoulder pain, and sometimes hip pain, and sometimes other places, but dramatic. So they can't brush their own hair, they can't brush their teeth or lift a cup, they can't even do this to like get a sip of water. And so PMR is terrible. And people who have PMR get a dramatically amazing response to prednisone. And so it works. And it is really hard because PMR usually means at least 1 year, if not 2 or even 5 years of prednisone. So I wanted to answer some of these questions that people asked. And I think related to this question of that you just asked about how do you tell the difference between an infection and prednisone withdrawal. Let's talk about how do you tell the difference between. So I'm going to show this one. This one, I got variations of this question, so many of them. And so I thought it was really important. How do you tell the difference between pain from coming off prednisone and pain from polymyalgia rheumatica? When you come off prednisone, it's not clear if it's still PMR pain. The PMR pain was worse when I first started, and PMR helped. And there's more to the story, but that's the most important thing is how do you tell the difference? And I asked this question directly to multiple professors of rheumatology. These are doctors who practice daily with PMR and other rheumatic patients. And there were several problems with the question. And the first problem is that it assumes that the doctor appreciates prednisone withdrawal as a real thing. So the pain from coming off prednisone, I'm going to refer to as prednisone withdrawal. And then the pain from polymyalgia rheumatica I just described as the shoulder pain. So it was fascinating that pretty much none of the doctors I spoke with appreciated that prednisone withdrawal is a distinct symptomatic disease feeling syndrome, I guess is the word. They did not appreciate it. And I have to admit that when I first became the prednisone pharmacist, I didn't either. It's definitely not something they covered in pharmacy school. And it sounds like they didn't cover it in medical school. But it definitely is covered in the scientific literature. And so, unless a doctor has paid enough attention to their patients to realize that when a person is tapering and goes from 10 to 7.5 milligrams, that amount of drop is causing dramatic pain and fatigue and horrible feelings. Like some people describe it as feeling like you're going to die. And that some doctors are calling adrenal insufficiency. And I actually pushed back on one of them because he was only a fellow. He wasn't a director. He wasn't a professor. Only a fellow at Johns Hopkins. Like that's basically one of the most qualified people in the world. But um he's still in training is the difference. The rest of them are done with training and so they think they know everything. So I pushed back on him. I said, when I think of adrenal insufficiency, I think of the inability to make cortisol and adrenal hormones. And he was like, okay, so what's the problem? And I said, every single person on prednisone experiences adrenal insufficiency, but they don't experience symptoms of adrenal insufficiency. What I think is that prednisone withdrawal is when your body is used to or dependent on a certain amount of prednisone to feel functional. And when we take some of that away by going from 10 milligrams to 7.5 milligrams, that is a big, dramatic 25% drop that feels horrific to some bodies, and to others, it's fine. It's not adrenal insufficiency, it's prednisone withdrawal. And it never quite sunk in. And so I said, how would you tell the difference between what he's calling adrenal insufficiency and what I'm thinking is prednisone withdrawal and the PMR flaring? And he didn't have a good answer. And literally no other professor did either. So I crowdsourced this question. I said, this is what I learned and this is what I didn't find an answer to. And I sent this out as a video and email, and the audience responded with some really great tips. And I loved these. So, both just a PMR couple, I'm not sure if both of them have PMR or just one of them, and a retired physician or internist who has PMR both responded with the exact same idea. And it's really similar to the answer I just gave about how do you tell the difference between prednisone withdrawal and an infection. And I think it's the same. The difference between prednisone withdrawal or pain from coming off prednisone and PMR pain, the way to tell which one it is, as far as I can tell, unless someone can come with a better idea, is you have to get a blood test to see if the inflammation markers in the blood are high. So if it's a PMR flare, then the CRP or C reactive protein and the ESR, which is erythrocyte sedimentation rate, both of those will be elevated. And that will help answer our question. If it's prednisone withdrawal, they won't be elevated. Generally, you can't test for prednisone withdrawal. It's a symptom, not a testable thing. It's kind of ruling out an infection, ruling out a flare, and the only thing left is is prednisone withdrawal. So that I think is a great answer. If anybody knows any researchers who could give us a definitive answer, that would be amazing. I would love to help do the study with them. So if you know anybody, I'd love to know. Okay, so I'm going to stop sharing that one. Okay, we've got a whole bunch of more comments and questions. Okay, so this is another good one. So Yin Yang says, how do you know when you're experiencing prednisone psychosis? So I think this is a super tricky question for a person to answer themselves. Um, I think you would need the insight of people who know you to know if you're experiencing prednisone psychosis. I interviewed the author of a book called Steroids Stole My Summer about someone who took prednisone, methylprednisolone, on and off, and it gave him steroid psychosis or prednisone psychosis. And he um he couldn't tell that he had it. He didn't have that insight. He couldn't say, "Oh, there's a reason I think my girlfriend is trying to kill me. Oh, there's a reason I'm like spending money rapidly. Oh, there's a reason I'm driving my car crazy." Like, it's not something you can see on yourself. You have to have someone who knows you, who's like, this is not you. This is not normal. This is the drug acting on your brain. And it's like, it really isn't you. It really is a horrific side effect that like is severe and must be treated immediately. This, if you're thinking you have prednisone psychosis, check yourself into the emergency room right now. Like, this is something that can ruin your life. I've heard of people doing things they did not plan to do, people who've done spent their entire life savings, people who have gambled, people who have said horrific things to their family members, leading to their children being taken away from them, leading to divorce. Like, so many people have contacted me about this saying, I did these things while on prednisone. Can you like write a letter to the court so they don't take my children away? These things happen and you do not want to let this go untreated. Like, check yourself into the emergency room, ask your family member to drive you, do whatever it takes to get this treated, because this is an emergency. This is not you. This is the drug, and it will go away, and you don't want to let the consequences follow. Yeah. Okay. I think that's good enough for that. I'll say Fazia says, I'm on prednisolone, but I get told I can't come off it due to adrenal deficiency. Yes, that is so hard. Some people who take prednisone for whatever disease, whether it's poison ivy, eczema, asthma, COPD, rheumatoid arthritis, or any of the other 1,000 reasons you could take prednisone, take it and they try to get off and they can't. They get stuck because of their adrenal system never kicks back on. So yeah, that is a really tricky situation. And then you went on to say, I really want to come off it and I'm tapering like 1 milligram every 2 to 3 months. That's fantastic. Tapering every 2 to 3 months by 1 milligram is totally reasonable. And when you're below 5 milligrams, there's a lot less risk. So I think keep on keeping on doing what your doctor says and just take it really slow and gentle. Like, this is a drug that's changing a lot of things in your body, up to 2/3 of genes. So give it time. Give it time. All right. So then Mohammed asks, how long does prednisone withdrawal last? Can serum cortisol levels help to get freedom from prednisolone? After taking prednisolone, whenever I get a fever, I feel a dramatic serious fatigue. Okay, so prednisone withdrawal can last as long as it lasts. How's that for a good answer? um, there, when I was pushing back against that Johns Hopkins fellow, I said, well, so how long would you let somebody suffer like this? And he said, oh, 2 weeks or so. And I thought, oh, okay. That sounds really harsh to like let someone be completely non-functional for 2 weeks, to basically have them having a flu-like feeling for 2 weeks that is totally preventable and avoidable by taking enough prednisone. So it can last as long as it lasts. For some people, it never goes away. For other people, it'll stop after a few days or a few weeks. There's no good research, no good answers to this question yet. So, can serum cortisol levels help get freedom from prednisolone? I'm not quite sure what you mean by get freedom from prednisolone, but basically, I think what you're asking is, if I test serum cortisol levels, are they meaningful to help me know whether I'm in withdrawal? And they're not. There's no point in getting your cortisol tested while you're taking prednisone. The research that I can find shows that the best time to test cortisol is 3 weeks after your last dose of prednisone. So there's no reason to do it while on prednisone. But then again, if you ask one endocrinologist and another endocrinologist and another endocrinologist and another endocrinologist what they think about this topic, you will get four different answers. So I've done a lot of studying of the scientific literature, and there's no good answer to this. But yeah, after taking prednisolone, yeah, you feel horrible. You feel this dramatic fatigue and fever, and I don't blame you for complaining about it. It is bad. And then you continue to say during infection, my cortisol is in a normal range. Um, no, I mean, so you're actually getting these blood tests and it's showing it's normal. Awesome. Should the cortisol level, like, of your blood be increased during infection? Not necessarily. But if you are dependent on steroids like prednisone or prednisolone and you get an infection, they normally recommend, for especially for people who have an actual diagnosis of adrenal insufficiency, to updose during times of stress like infections. So if you were to get an infection and you're normally on, say, 20 milligrams a day, you'd go up to 25 milligrams a day or something like that. You definitely talk to your doctor about it. So it's called updosing, but it doesn't mean that your cortisol level itself changes. Okay. All right. Now we have another one. Achieving jhana. Does facial hair would continue to grow even after my prednisolone is stopped? So normally the facial hair and other hair changes, whether it's male pattern hair loss or male pattern hair growth, um, usually happens while on prednisone. And it's because the prednisone is it's part of a cascade of hormones. So we normally have um, a hormone up here that's kind of like the mother hormone, and cholesterol is right before that. And then they branch into all these different hormones. And then there's enzymes that send them back and forth from each other. But cortisol, which is what prednisone becomes, and the sex hormones like testosterone are really close on this tree. They're very, very similar. And your body can find ways to turn one into the other. And so for some people, it turns cortisol, all of this excess cortisol, into DHEA or testosterone or 5-DHT, other male pattern hormones. And so theoretically, when you stop giving this excess hormone that your body doesn't know what to do with, theoretically, the conversion to the androgens stops. And so it should slow down and stop after, but there's really not a lot of research on this either. Okay, so let's share some more questions from the survey. I like this one. Okay, so this goes back to our cortisol question that we have been hearing. So there was this question: any chance of a prednisone pump like they have for insulin? My stress activity level changes daily, but the prednisone level is flat, which I think causes the flares. Also, more guidance on dosage. Possible advice on changing dosage when daily situation changes and need more cortisol to adapt to the change. So there's actually a pump out there. This is so cool. I was on the board of a nonprofit organization for 5 years. And the original organization was called Adrenal Alternatives Foundation. And then it changed its name, and I believe it's the American Adrenal Foundation or something like that. And essentially, the whole point of this nonprofit is to help people dealing with prednisone, cortisol, adrenal insufficiency problems who aren't able to really get good results from a pill form of prednisone to switch over to an injectable form. And they help you know exactly which pump to use, help you fight your insurance company to pay for it, and know which liquid forms of steroid, like methylprednisolone, that you can use to put in the pump and help you and your doctor figure out the dosing. And so they have a lot of resources at, I believe it's americanadrenal.com or .org or something like that. Just Google Adrenal Alternatives Foundation and then it should take you to the right place. And so, yeah, they have great resources about changing dosage and all of those things. So that should answer your question. Okay. Back to more questions. Lori says, what is your opinion of trying a biological to taper down on long term use of prednisone? So I'm not sure what you're taking prednisone for, but this is one of the coolest things I learned about at Harvard Medical School at the seminar. Um, when I became the prednisone pharmacist, there were no alternatives to prednisone for giant cell arteritis and polymyalgia rheumatica. There was nothing else that could help. And what's even more sad is for giant cell arteritis, where these arteries are so swollen, it can cause vision loss, like blindness. That the prednisone didn't even work that well, but there just wasn't any other option. Um, they did a study showing that the average flare of GCA was at 9 milligrams. That was average. Some people flared higher than that, other people flared lower than that. But the average flare, especially for women, was at 9 milligrams. But the side effects are bad anywhere above 5 milligrams. So there was no good place for a person to get to. That if you try to go below 9 milligrams, you're probably going to flare, but your side effects are horrible anytime above 5. So there was no good balance, and they were just failing women with giant cell arteritis. So what's been amazing is finding out about all these new biological medications that are being tested and getting FDA approval for these diseases that have been rare and had no other options. So that's been amazing. So some of them that I learned about are Stelara, Rinvoq, Actemra. Did I ever say Kevzara? These were amazing. And for different diseases, they have different FDA approvals and different um, level of goodness of how well they work. But they might sound scary because most of them are injectable medications. And because they've gone through the rigorous FDA approval process, we know every single side effect listed and the percentage of people and how likely it is that all of these horrific, like rare things are going to happen to you. Whereas prednisone is this super old drug that was never ever tested. So we have no idea how often any of these side effects actually happen. So it doesn't seem as scary, even though prednisone should terrify you. One of the professors said, steroids are the best drugs we have in rheumatology, and steroids are the worst drugs we have in rheumatology. It works. It's amazing. It is so fantastic. It saved my life. Prednisone did. But doing anything you possibly can to get on a lower dose to get off of prednisone is the best choice you possibly can make. Because every single other drug that is available on the market is less harmful than prednisone. Prednisone is the most harmful drug. It causes 150 or more side effects that we know of because it's so old it never got tested. We don't actually know them. And these other drugs have less side effects, are less likely to harm you. What side effects were they worried about the most at this event? Bone loss, bone breaking, fractures, loss of height, bone death, joint replacements like hip replacements, pneumonia, and other infections that lead to death, heart disease of any kind, whether it's heart failure, heart attacks, heart arrhythmias, strokes, are all way worse when on prednisone. Diabetes and other metabolic problems are all way worse on prednisone. Weight gain, blood sugar issues, on and on. Those were the 4 worst ones that they were concerned about, but there are 150. Whereas these biological medications might increase your risk for infections. Well, prednisone's doing that too. and is actually doing it worse. So yeah, they're increasing your risk for infections, but it's less. And yes, they're very expensive. And yes, they require a needle, most of them. But I would personally rather have a needle to treat my disease and allow my prednisone dose to go down than have a needle when I'm having a heart attack to treat the my heart failing. You're really choosing when the needle is, essentially. Do you want it when your body's falling apart because of all the damage prednisone has done, or do you want it to prevent the damage from prednisone? That's how I see it. If it were me and I have any disease that requires prednisone, whether it's giant cell arteritis, PMR, my disease, ITP, I would find any way to go on an alternative. And that's exactly what I did. I was on prednisone for a long term and I was like, get me off of this. What are my options? And they said, we can get rid of your organ called the spleen. We can remove that because that could be what's causing your problem. Or you can go on a biological medication called rituximab or Rituxan. So what did I choose? To hold on to my organ and use the Rituxan. And guess what? I've been in remission for almost 7 years. That choice has saved me so much further damage to my body. I'm so glad I am able to have strong bones still, because if I'd been on prednisone for the last 7 years, I guarantee at this point I'd have bone loss. I would have lost height. It's horrible. Wow, we're getting a lot of comments. Woo! Okay. So I hope that answered your question, Lori. All right. Okay. This is a fun one. Thanks. So I already answered Yin Yang's question. So this is a follow up. I'm seeing a doctor. It's not bad, but my mom has noticed something off. Another topic is that how bad prednisone affects guys, causing ED. It is embarrassing and frustrating too. Yes. So back to, I talked about the hair loss and the male pattern hair loss and hair growth. Prednisone can change the sex hormones like testosterone. For women, it can increase it or decrease it. For men, it can increase it or decrease it. And for a lot of men, it affects the sperm ability, the erection ability, and it's really sad and really annoying. Um, I would definitely talk to your doctor about that. There are ED drugs that you can use. They can maybe prescribe it for you. And while you're at it, get your heart checked because often ED and heart issues go hand in hand. So that's super frustrating. All right. Ohio Beverly says, I have EGPA and started prednisone taper 5 days ago and symptoms have flared. How do I know if this is due to EGPA or actual withdrawal? I went back up to my last dose per my rheumatologist. This is like that golden question that I stumped every rheumatologist with at Harvard. And it's really, there's no good answer to it. For EGPA, it's even harder because for PMR, we can easily test the blood and say, oh, look, it's your flare of your disease. Whereas with EGPA, I mean, did the eosinophils go back up? Maybe that is a test they could do. It's really up to your doctor. Um, and if it's your symptoms that you normally have with EGPA, like I think that's one of the most important things is what does it feel like when you have active disease? And is this thing I'm feeling like that or is it new? And if it's like that, then it's probably your disease flaring. If it's new, definitely tell your doctor, see if it's an infection or prednisone withdrawal. But like you said, the treatment is go back up to the last dose where you weren't feeling that way and then try a slower taper. Okay. And oh, you're now on a biologic and take prednisone. So it sounds like you're just waiting for the biologic to kick in, and that's probably why you were tapering. Okay. Good question. Achieving Jana. How long would it take moon phase to go away after the prednisone is stopped? So one researcher did some studies about prednisone and moon phase, and he showed that Most people who were on prednisone long term started getting moon face between 3 weeks and 3 months, and it started going away sometime around 5 milligrams. And for most people, it was totally gone about 3 weeks after their last dose. But there was variation in that. So some people, it's longer than that. It was a year until their moon face was totally gone. And other people, they lost their moon face up at 10 milligrams. So everybody is different when it comes to moon face and when it goes away. Okay, Abstract said, can prednisone suppress or lower stomach acid production? So prednisone does all sorts of bad things to your gut, um, especially when it's taken alongside over-the-counter pain medicines like ibuprofen, naproxen, and prescription versions like meloxicam or Celebrex, celecoxib. These are NSAIDs, non-steroidal anti-inflammatory medications, and the combination of the two is very harmful on the gut. So if you're having gut issues, figure out if there's a better alternative for this or this that you can minimize that complication. But yes, it can suppress or lower stomach acid production. It can thin the lining of your gut, leading like that, especially this drug interaction can thin the lining of the gut, leading to potential ulcers, like holes in your gut that are painful and can actually bleed and kill you. Like a bleeding ulcer can make you bleed to death. That's a thing. So, if you are dealing with prednisone and gut issues, definitely let your doctor know, step one. And step two, with their permission, um, you can start an over the counter medication that's a PPI, proton pump inhibitor, that like omeprazole, pantoprazole, esomeprazole, Nexium, Protonix, all of these medications that you can buy over the counter now. When I started in pharmacy, they were all behind the counter and needed a prescription. But these can help protect your gut lining from the damage that prednisone and these drugs can cause as a drug interaction. And a lot of people take them wrong. So I want to tell you how to take them. You should take them first thing in the morning on an empty stomach, 30 minutes before anything else, or 30 minutes before dinner. And that way it opens up your proton pumps and it allows you to close them because your stomach starts making acid in preparation to eat. And so it's able to attack it right at the right moment. Okay. Let's see. Have you heard of TSW or TSA? You're dealing with long-term topical and injections of Kenalog. Immune system went haywire when stopped. Had to go high dose, then 2 years later still suck. I have not heard of TSW or TSA. If you know what it stands for, that would be cool. But dealing with long-term topical and injections of Kenalog, that must be so hard. And yeah, if you stop that, it sounds like you basically went into withdrawal of the Kenalog, which definitely would have immune system issues. That's tough being stuck at 5 milligrams. Okay. Beverly has a love-hate relationship with prednisone. Don't we all? It has saved my life, but it is killing me in other ways. Injectable biologics are so easy to use. I've been on Nucala and now on Fasenra. Thank you for sharing that, because we often hear these horror stories about prednisone, but we don't necessarily hear these good stories about the biologics and how well they work. I'm not getting paid by pharma. Like, I get nothing, not a penny, nothing. I don't even work in a pharmacy. Like, I have no vested interest in pushing biologics on you. My only thing is minimizing prednisone side effects. I'm all about whatever you can do to minimize prednisone side effects. And so if that means going on a very expensive biologic, do it. Because my personal mission in life is minimizing prednisone side effects for everyone, whether that's never taking the prednisone for diseases that shouldn't be taken for, like, for example, the flu, pneumonia, most pneumonias, unless you're hospitalized, for COVID, for strep throat, for ear infections, for all of the things that a kid can bring home from school. is never an acceptable reason to take a steroid, ever. And so my mission is to do whatever it takes to minimize side effects by getting people on the lowest effective dose, by preventing inappropriate prescribing, whatever it is, get you on the lowest amount possible. Okay. Um, all right. You want to know how long I was on prednisone? I started prednisone in October of 2017 and I finished in June of 2018. And I went on like roller coasters. At the beginning, I was at 60 milligrams for about a week. And then that stopped working. And so then they tried super duper high dose. Actually, no, it was longer than that. Anyway, eventually, 2 or 3 weeks later, they tried dexamethasone, 10 of the highest strength tablets per day. Like this was the nuclear option, like pew, off the charts for 3 days, 4 days. It was horrible. And so in those 4 days, I essentially had the same amount a normal person would take over a year. So while technically I only took it for like 9 months, those 4 days I got a year's worth. So yes, the time period, but I feel like my body has been exposed to more than a normal person would have over 9 months. Most people will never be exposed to that much, even in a year. Okay. Lori said, "Thank you so much, Dr. Megan. You have influenced my decision." I'm so glad. Okay. Beverly said, "It's like that on steroids." LOL, pun intended. Okay. All right. Yin Yang says, "I'm on Nucala now. I was on Fasenra. It is too expensive. My insurance will not cover it." Yeah, that's the hardest part with biologics is trying to get the payment, trying to navigate insurance and, getting people to write the right letter to include all the right details. And I actually got to work on the backside of that. I was actually the big bad bureaucrat who got to read those letters written by rheumatologists to say whether or not a person got it. And so I have really good tips about how to navigate it if you would like me to cover that sometime of what to do and what not to do to get your biologics covered. Okay. All right. Achieving Jana says, "I was diagnosed with Bell's palsy. I have to take prednisone for 45 days, out of which 35 days have passed. Would this short course still give me severe side effects like bone loss, etc.?" Okay, so that is a important question. When I was in pharmacy school, the way they talked about prednisone side effects, especially bone loss, was you don't need to worry about that until later. It's not a problem. But the more research they've done recently is they did this huge population study looking at insurance claims of people who were only on a short-term amount of prednisone. And we're talking like 10 days. And then whether or not they got certain things later, whether or not they got a bone broken, a fracture, or they got pneumonia or sepsis infections. And there was an increased risk for fractures. There's an increased risk for sepsis. There's an increased risk for pneumonia, even with short-term steroids. So there is harm. There is increased risk, but not everybody gets it. And Bell's palsy is terrible, and you've got to treat it. So it's always a question of benefits and risks. Not treating Bell's palsy, bad. Getting prednisone side effects, bad. Which one's worse? I'd say Bell's palsy is a lot worse. And so if it were me, I would try to do whatever you can to get that balance to be as balanced for you as possible, getting on whatever the dose is that's going to keep your Bell's palsy at bay and minimizing side effects, right? All right. Holy cow, so many questions. All right. So back to endocrinologists said my body is steroid dependent. I had PMR and Cushing syndrome. PMR is now inactive and one of my adrenal glands was removed. I am now on 8 milligrams of prednisone and feeling pain. Steroid dependent is true. For a lot of people who have to take prednisone, you become steroid dependent. And the only way to become non-steroid dependent is to incredibly slowly taper off and see if you can handle it. And if you can't, then you become adrenal insufficient and you must supplement with adrenal hormones the rest of your life, whether it's prednisone or hydrocortisone or methylprednisolone or whichever drug to replace it. Oh, this is a great question. Okay. So Alex said, do you think Nutrinize is enough for a prednisone dose of 60 milligrams daily for 5 weeks and a taper after for lupus? Okay. So what is Alec talking about? Alec is talking about Nutrinize Zone. And this is a morning bottle and a bedtime bottle that is designed to help minimize prednisone side effects. And so basically, Alec wants to know what, like, is the amount that's in these bottles enough for a 60 milligram dose? And that is a super good question. I have had people ask, okay, what if I'm a really big guy, like more than 250 pounds, or what if it's a kid? Should we use a different amount? And I agree that the higher the dose of prednisone and higher than 250 pounds or less than 100 pounds, we need different dosing. And so this is enough of replacement of the nutrients that prednisone is stealing, such as calcium, vitamin D, magnesium, potassium, these things you have to prevent the bone loss that I've been mentioning. They're in there. There's also magnesium and melatonin to help you get restful sleep and have a good mood. There's also ingredients like chromium and cinnamon and berberine to help with your metabolism and not gaining so much weight. All of these ingredients are in here because they counteract one or more prednisone side effects. And prednisone is causing these side effects because of nutrient depletion. It's stealing them. In fact, the doctors who prescribe prednisone the most, the rheumatologists, created a guideline called the Glucocorticoid-Induced Osteoporosis Guideline. And in it, they recommend calcium and vitamin D for everyone who's taking more than 2.5 milligrams of prednisone. So you can meet that guideline using Nutrinize Zone. And I invented it, and I use the best manufacturer and the best ingredients. And so is this enough if you're taking 60 milligrams? I think if you're only on 60 milligrams for a week, it would be enough. But you're on it for 5 weeks. I think you should probably go, instead of 2 in the morning and 2 at bedtime, you should probably do 3 in the morning and 3 at bedtime for those 5 weeks. And then once you're getting below like 30 milligrams a day, you can go back to the normal dose of 2 in the morning and 2 at bedtime. But for that time period, you'd want to get more of it to help support you, because you're getting so much depletion of the ability to have a good metabolism, of the ability to have good bones. So great question. Thank you, Alec. Okay, so we have Peter. Hide. I don't know why it won't let me show it. Okay. Peter says, hi, please, can you help me? My doctor wants me on steroids as soon as possible. I'm on 8.5 now. My shoulders are getting very painful. I can't sit down on anything very painful. Only some relief when I'm laying down on my bed, on my bed. I have polymyalgia rheumatica. Feel like I've been run over by a train. Yeah. That sounds like polymyalgia rheumatica. It sounds like you have both your shoulder issues, and the reason you can't sit down is because you have the hip issues too. Yeah, that's horrible. I don't know what your question is, what you need help with, but I agree that you need prednisone higher dose. I guess if you're on 8.5 and you're having all this pain, you need to go back up to a dose where you weren't having pain. Okay, Beverly. Okay. Achieving Jana. So how can we minimize the side effects of prednisolone? So there were several things I've mentioned. First, only taking prednisone if you actually need it. And that's only a question you can answer with your doctor's help. And second, getting on the lowest effective dose. So for certain people, certain doses are way too high, and you could be on a lower dose and get the same exact benefit. So get on the lowest effective dose for you. Third, third is you need to give back the nutrients prednisone's depleting. And that's like prednisone is stealing from your savings account. It's stealing from, like, for example, prednisone is basically that emergency that you had a rainy day fund that you saved all this money for, and it's spending it. It's spending it all. And the higher the milligram you're on, the more it spends. And so that savings account in your body is in your muscles, it's in your bones, it's in your liver, and it's stealing all the goodness out of them, all of these nutrients, whether it's calcium, vitamin D, collagen, magnesium, and it's just using that. And now you're low. And in fact, it's blocking your ability to get enough from food as well. And so you've got to give back more than what you're depleting to keep you stable. So you've got, like, if you're looking at the amount of prednisone and the amount it's stealing, it's going to be the higher the milligram, the more stealing there is of these nutrients, the more loss of calcium and magnesium there is. And so you need to give it back by taking something like Nutrinized Zone. I've designed it specifically for the needs of people on prednisone. It gives back all the nutrients that it depletes and makes you feel really good again. Like, instead of feeling so depleted, like you've been run over by a train or you're feeling horrible, this helps you feel back to yourself again and just brings that balance back. Okay. Oh, Beverly, I love this. My new mantra since diagnosed with EGPA is choose your hard. Don't be afraid of treatments. What a great perspective you're sharing, that when you have a disease like EGPA or PMR or others like mine, ITP, you're choosing, like, no matter what happens, you're choosing something, and there's going to be a benefit and a risk to it. If you choose not to treat your disease, for GCA, you might go blind. For PMR, you're not going to be able to move. For me, I'm probably going to bleed to death, right? You could choose that hard. That would be really hard. Or you can choose to deal with prednisone side effects. Or, oh, I forgot my fourth thing. Or you can get on a biologic. That is a different kind of hard. It's using a needle. It's a different number of side effects. Or you can do this, get some Nutrinize on board to help minimize those side effects. No matter what, you're choosing your hard. I love that perspective. All right. Yin Yang said, unfortunately, I've been on prednisone for so long for my asthma that I lost all my teeth from prednisone and prednisone inhalers too. Oh, that is terrible. Yeah, what prednisone does to bones and teeth is horrific. I've heard of so many people with dental issues from prednisone, and that it, no matter what you do, you're having a hard. Either you're not breathing from the asthma or you're having to use something to be able to breathe. And that something is causing the bone loss and the teeth issues. Wow. Yeah. So we need to do things to make life better, right? Okay. More questions. Okay. Does prednisone cause anxiety and palpitations? Yes. So prednisone is mimicking our body's naturally occurring hormone called cortisol. Cortisol is our body's stress hormone to help you survive stressful situations, whether it's um, a famine, like there's not enough food, or a war, or there's infighting in the tribe, or whatever it is. It's helping you survive and be able to get away from danger. It turns on your fight or flight hormones like epinephrine so that you can run as fast as you can. So your heart beats fast enough. And for some people, when prednisone does its job, it's mimicking cortisol and it's turning on these fight or flight hormones. And that makes you feel jittery. It makes you feel anxious and you have heart palpitations because you're being given the ability to run away from this disaster, but there is no disaster. It's just your disease, right? And it's a hard thing to deal with. And so, what some people do is they counteract that anxiety and palpitations by doing one of the few things we can control, and that is breathing slowly. So, if it were me and I was dealing with that, I would find a breathing exercise that you can listen to, whether it's on YouTube or on some app like Calm or Headspace, and they can help you slow down your heart rate, that palpitation feeling, slow down the racing mind, the anxiety, the jitteriness. Because when we slow our breathing, it slows our heart rate, which calms our mood. It's basically going from that fight or flight, life is an emergency, to rest and digest. I'm at a feast. I'm surrounded by friends. I'm in a loving, peaceful relationship. Life is calm. That side of your nervous system. And so the way you can do that is by using deep breathing to slow it down. Okay. Find something like that. And sometimes you feel like crying for no reason. And that's the prednisone for sure. And so if you do what I just said and try that breathing exercise, and if it works, fantastic. There are some other options. There's a medication called propranolol that's actually a blood pressure medication, but it can help slow all that down. And then because of prednisone, some people need medications to deal with the side effects. And that might be anxiety medications or antidepressant medications. And there is no shame because this is the drug causing a side effect and you need to still function in life. And so if you get to that point, then definitely talk to your doctor about it. The hard thing about those is they take a while to kick in. And sometimes it gets worse before it gets better. And so you have to be ready for that. That maybe for the first 2 weeks, you're not going to see goodness yet. But then after like 4 weeks, it's like, oh, I feel so much better. All right. Okay. Donna. Sorry, I think this got missed, but is 5 milligram daily prednisone okay to take long term as it's more of a physiological dose? Will it harm bones, adrenals, etc.? All right. So that's one of the things I learned at Harvard from one of the professors was what is a physiological dose? So the research that I have read and found shows that 2.5 milligrams is a physiological dose. And what I mean by that is your body naturally makes approximately the equivalent amount of cortisol as is in 2.5 milligrams of prednisone. So that's what you normally would be making. That's what I had read. But this professor I talked to, he said that endocrinologists who have to give people steroids to replace it usually end up giving about 7.5 milligrams of prednisone equivalent, whether it's hydrocortisone or methylprednisolone. And so I thought that was interesting. I had never heard that. And I agree that that is probably how much an endocrinologist does prescribe. So that was really interesting. So then the question is it okay? Will it harm bones and adrenals, etc.? And there were actually 3 presentations where the professors from Harvard, from University of Pennsylvania, and St. Louis College of Medicine, um, and another place. Anyway, they all talked about this, about 5 milligrams. Like that was the magic number they all talked about how previously in rheumatology, 5 milligrams and below is considered okay and that there's not a lot of risk. But then they showed the results from newer, bigger studies showing that 5 milligrams is actually not okay for bones, that you're at an increased risk for fractures, especially of the spine. So they're like compression fractures where um, the different vertebrae get crushed into each other and you lose height. And some people never even know it happens until they measure their height and they're suddenly shorter. Other people get incredible pain. So that's the most common type of fracture that is around 5 milligrams. And then adrenals. So you're not particularly harming your adrenals. Like every single person who takes prednisone will essentially just tell their adrenal system to take a nap. Whether it wakes back up again is a different story, and that has nothing to do with whether you're on 5 milligrams or not. It's nobody actually knows what is causing your adrenals to not wake up, but for every single person, the adrenals take a nap. And then theoretically, when you taper, you slowly wake it up like a sunrise and it starts making cortisol again. So adrenals will not be harmed. What else they talked about that will be harmed is heart disease. You have an increased risk for heart disease at 5 milligrams and definitely above 5 milligrams. And infections. You have an increased risk for pneumonia and sepsis at 5 milligrams and above. So the question is it okay for your disease? Because without 5 milligrams, what are you going to do? If you have rheumatoid arthritis or some other disease that is long-term, chronic, miserable, you're not functioning without 5 milligrams a day, is that better than the risk for heart disease, infections, bone loss, and all the other things? Which is worse? And really, at 5 milligrams and below is where there's this like, it's super gray above 7.5, above 7.5 milligrams, it's gray turning black. Like there's no doubt about it. At 10 milligrams and above, that benefit is not in the favor of prednisone. But at 5 milligrams, it's like, maybe it is, maybe it's not. You are aware now that there are risks for these things. Does everyone get it? No. But you have an increased risk. And so does everyone with your disease at 5 milligrams suffer, like below 5 milligrams suffer? I have no idea. I don't know what you have, but it's a question you got to talk to your doctor about because I have no idea why you're taking it. I have no idea how effective 5 milligrams is for you. And so, yes, there's a risk, but yes, there's a benefit, I'm assuming, right? Okay. Let's look at some more. Oh, now I've scared someone. Now I just have to stop taking prednisone. How many days will it take to get back my normal face? I actually covered this a few minutes ago. For some people, you get it once you're below 5 milligrams. For other people, 3 weeks after prednisone. For other people, a year after prednisone. Pretty much everybody at a year has lost their moon face. Okay. My mom is 82, takes prednisone for adrenal insufficiency. She reduced from 10 milligrams to 5 milligrams several years ago. She is now showing signs of dementia. Would increasing her dose help with her memory? Oh, that is a tricky question. So, prednisone itself increases your risk for dementia, brain fog, confusion, delirium, and usually the higher the dose, the worse outcomes for your brain. So, I don't know why she's getting dementia. I don't know if there's some reason, like, there are different kinds of dementia, and if that kind is being caused by some sort of inflammation, and when she goes down on dose, it's allowing it to get worse, or if the fact that she's 82 and people get age-related dementia at that age is the reason, I don't know. But the general principle is that the higher the dose, the worse the complications to your brain. So if it were my mother, I would not want her on 10 milligrams. I would keep it at 5 if it were my mom, but definitely talk to her doctor about it. Can prednisone affect you more if you have sleep apnea? If no prednisone, I know prednisone can affect your sleep. Prednisone can definitely affect your sleep. It fragments your sleep. It makes it harder to get restful sleep. You feel a little more jittery and nervous, and you don't get as restful, good quality sleep. And so if you have sleep apnea, that's also fracturing your sleep, making it all fragmented and you're not getting deep, restful sleep. And so, yeah, if you have sleep apnea, it's definitely going to be worse. And I would definitely get a CPAP and do what you can to minimize the sleep apnea. Is mild splenomegaly a side effect of prednisone? I have not heard of that uh, as a side effect. Not, it's possibly, but I haven't heard of it. Okay. Beverly says, exactly, choose your hard. Yes, that's that benefit and risk. Which is worse for you? Is it the disease not being treated, or is it the risk for those side effects? You got to choose your hard. No matter what, it's hard. You choose it. Thank you, Beverly, for this beautiful perspective. Anybody else have any inspiring thoughts before we close? This has been so much fun. Thanks for everybody who joined us. We've had lots of comments. Oh, more? Prednisone affects my REM. I get less REM on prednisone. Yes, REM sleep is less for sure on prednisone. And I have a love-hate relationship with sleep trackers because it's really cool to see, oh, I'm getting this much of this sleep. I'm sleeping this many actual hours. But then some people get sleep anxiety because of the fact that they're tracking their sleep so much. And it's like, oh no, I'm not going to get good sleep tonight. And it's like a self-fulfilling prophecy. And so sleep trackers are so amazing that we can do it. And also sleep trackers can worsen sleep for people just because you're tracking it. And it's like performance anxiety. Like, I'm not going to sleep good because I'm thinking about it. So if you're that type of person, maybe give the sleep trackers a break. I don't know. It's up to you. Okay. All right. Thanks everybody for joining us. Go to neutronize.com or Amazon and get Neutronize to help you with your side effects, because when you're choosing your hard, this is one of the ways to make it less hard. If you have to take prednisone, you have no other choice, then you take this alongside it and it minimizes your risks. It makes life so much better. It's 2 a.m. and 2 at bedtime. And if you subscribe and save, you can save a lot of money to make it a lot more affordable if you're going to be on prednisone long term. So just go to neutronize.com right away and get the support you need. Designed by me, doctor of pharmacy, board certified pharmacist in ambulatory care medicine. With how many years have I worked now? 26 years in pharmacy. So this is exactly what you need to help you with your prednisone side effects. Go to neutronize.com and get the support you need. Signing off as Dr. Megan, your prednisone pharmacist.